Your dog's just been diagnosed with arthritis and your brain's probably going 100 miles an hour. But it's not too late. There's loads you can do, and in this video we're going to talk through it. My name's Jim Wilshire and I've helped thousands of dogs live well with arthritis. Over the past 20 years, I've opened 4 vet practices. I've helped hundreds of young vets get started in their career, and I've led a number of pet-related projects. I've had the conversation that we're going to have now with hundreds of worried owners like you over the years. My dog Molly suffered osteoarthritis, so I've seen this condition from both sides of the consult table. Arthritis in dogs, and specifically in this case osteoarthritis, causes pain, mobility and stiffness over time, and it's what's known as a degenerative joint disease. Broadly speaking, it occurs for one of 3 reasons. The first being that we take a normal joint and we abnormally load it. So this would typically occur in a dog where it hurts one of its hind legs. As a result, the other hind leg ends up bearing more of the weight and more of the load. The second time this occurs is when you take an abnormal joint and you normally load it. So this would be more typical with the dysplasias we find in certain breeds. So for example, that might be hip dysplasia in Labradors or elbow dysplasia in Spaniels, where the joint is slightly abnormal from birth. And ultimately, that dog continues to live its life, loading it normally, but sees an accelerated degeneration in that joint because of the slight inconsistencies and abnormalities in the joint to start with. And then thirdly is the wear and tear osteoarthritis, the one we're all likely to experience some part in our lives, where over time the cartilage that forms part of the natural shock absorbing in the joint slowly thins, and ultimately the wear and tear starts to accumulate. So let's start by looking at the normal anatomy of a joint. So the purpose of the joint is to bring 2 bones together in a comfortable way to allow a range of motion for the animal. Now, bone on bone is painful, and that's ultimately what degenerative joint disease is. So in a normal joint, you have 2 layers of cartilage, one on the end of each bone, that acts as a shock absorber between the bone surfaces. That's then wrapped up with the synovial membrane around the outside that allows a honey-like fluid called synovial fluid to occupy the space between the 2. And ultimately, those 3 things allow that joint to come together and be non-painful and allow a smooth range of motion for the animal. If we use this plastic model of a dog's hips and pelvis, what we have here is what's called a ball and socket joint. So in this case, it's slightly different to my diagram, where effectively on the end of the ball, all of this would be coated with cartilage, as would the inside of the socket or the acetabulum. Okay, and then in between there would be the synovial fluid, and then the synovial membrane would wrap around, protecting that space and making sure the synovial fluid stays put. And these 3 structures provide a friction-free and hopefully pain-free range of motion, whilst also providing some shock absorbency should the dog be forced to land suddenly or make a quick movement. In the 3 situations we talked about earlier, ultimately the cartilage becomes thinned. It may crack and reveal bone on bone, which becomes painful. The body's reaction to this is to flood the area with inflammatory cells, which thicken the synovial fluid, and they also thicken the synovial membrane, leading to that typical warm, hot joint we've all experienced when we've had a sprain or a twist. As the joint begins to degenerate further, the body tries to stabilize it by adding new bone. These are often called bone spurs or osteophytes, but ultimately they end up reducing the range of motion for the animal. So the combination of the reduced and thin cartilage, the thickened synovial fluid and membrane, combined with the bone spurs, ends up with the signs that we typically associate with osteoarthritis in dogs. So if we come back to our model, we've got our normal range of motion here, nice clean joint surfaces. On the other side of this model, we have degenerative joint disease or osteoarthritis. What we can see is huge amount of bone spurs or osteophytes that the body's laid down to try and stabilize that joint. Whilst you might not be able to hear it, in actual fact, it's much crunchier in there, and we have a much smaller range of motion as a result. Ultimately, the chronic degeneration in the joint leads to changes that we all start to detect. So this may range from a reduced range of motion, a lameness on one leg, a hesitation to move on slippery floors, a reluctance to go for walks, perhaps a change in demeanour. They may become more grumpy. If we start focusing on treatment or management of osteoarthritis now, the single most effective intervention we can have is weight loss. By reducing the amount of weight they're carrying and loading those joints with, we can slow the progress of the degenerative joint disease that they're experiencing. And our advice here is always to work with your veterinary practice, particularly the nurse clinics, to come up with a management plan and a weight loss plan that works for your dog and isn't too drastic of a calorie restriction. Non-steroidal anti-inflammatories or anti-inflammatories are one of the first lines of treatment in managing dogs with degenerative joint disease or osteoarthritis. Non-steroidal anti-inflammatories have the combined effect of both reducing the amount of inflammation, so those inflammatory cells that have flooded our synovial fluid and our synovial membranes, whilst also providing pain relief at the same time. So whilst they're not reparative, they do have an effect on improving the quality of our joint. And very often they can be used as a treatment trial. So in your older dogs that perhaps are sleeping more or are slow to move and get up, by using a short course as a treatment, we can see if we improve their quality of life and get them moving better. But as you get to know the inflammatory process and your dog's response, then you can start to use them in a more tactical approach without necessarily having to give them the course. You could use them preemptively if they're going to be having a busy day, and you can titrate it down to the lowest dose you can get away with whilst maintaining their pain relief and the anti-inflammatory effects. Non-steroidal anti-inflammatories work on the prostaglandin pathway. So side effects we see from them is associated with changes to those pathways. So these are largely related to gastrointestinal upsets, sometimes renal disease, and very, very infrequently you can see liver problems. However, in the clinic, it's very rare we see any of these. Another treatment option available to us are monoclonal antibodies. And these are relatively new to the market. Currently, there's only one product licensed in the UK. And these work in a clever way by binding to the nerve growth factor. And the idea is that by blocking the nerve growth factor, which is upregulated in painful conditions and particularly in osteoarthritis, it prevents the pain actually from happening at all. So it can have huge impacts on comfort and analgesia in dogs that are affected with osteoarthritis. But on the flip side, they actually only provide an analgesic or a pain relieving effect. They don't reduce or modulate the amount of inflammation that's happening in the joint itself. And there is a very, very small amount of evidence from the human medicine and a little bit from veterinary medicine now, where in actual fact, they can perhaps exacerbate the degenerative joint disease because the dog ultimately can't feel, is completely pain-free and continues to use that joint as normal. Another approach to managing osteoarthritis is the use of joint supplements. And these are hugely popular. The evidence is very, very mixed for their effect. The general consensus is that using them in early cases or to prevent the onset of degenerative joint disease or osteoarthritis is the best approach to them. So with this multimodal approach of weight reduction, potentially some non-steroidal anti-inflammatories, potentially some monoclonal antibodies, ultimately what we're aiming to do is make our dog or reduce the amount of pain our dog is experiencing, and hopefully while mitigating some of the inflammatory effects that are happening in the joint. But ultimately keeping that dog moving and maintaining its muscle mass, or better yet, increasing its muscle mass, is a huge protective effect. By increasing our muscle mass, provided we're not increasing our total mass that much, we are helping to protect the joint and provide extra structure and rigidity around it. Whilst I've done my best to cover off the information regarding arthritis in this video, there's still a huge amount more to give you. So if you found it useful and you'd like some more information, follow the link in the description and sign up for our arthritis email tip series.